welcome to those of you who are attending both in the European and North American continents. Good morning and good afternoon. Again, my name is Dr. James Buck. I am a Senior Managing Scientist at Exponent. I'll be serving as the moderator today of the webinar. My experience is that I have over a 40-year career in toxicology, primarily focusing on mechanism of action. We're pleased to have all of you here today for the fourth in a series of webinars addressing the overall health effects of glyphosate. Today's webinar is entitled Specific Target Organ Toxicity After Repeated Exposure, STOT-RE. Does a classification for glyphosate need to be considered? As I just mentioned, this is the fourth in a series of webinars. The previous three, the first one dealt with cancer in both animals and humans. The second one dealt with modes of action of potential carcinogenicity, including genotoxicity and oxidative stress. That was then followed by a webinar addressing the reproductive and developmental toxicity of glyphosate. And of course, today's webinar is focused on specific target organ toxicity and classification. I should emphasize that all of these webinars are available on the Glyphosate Task Force website. That website is www.glyphosate.eu. So all of you can go back and see the previous webinars as well as this one. That includes all of the slides and the questions that have been asked at those webinars. I would also emphasize that if you have a question that might occur to you after the close of today's webinar, you can submit those questions to the website webinar address. I would ask today that as we go through the presentation that you would wait until the end of the presentation, and that is where we will address the questions that you send in. We're very pleased to have with us today as the presenter Dr. Martens. Dr. Martens is a well-known consultant in preclinical toxicology and development. He has been admitted to the European Register of Toxicology, and he has held senior positions at Johnson & Johnson, Monsanto, and the Scientific Institute of Public Health in Brussels, where he engaged in several important questions of toxicology and risk assessment, including OECD, IPCS, IARC, and ECOTOX. Dr. Martens holds his PhD in pharmaceutical sciences with an emphasis in toxicology from the University of Ghent, and over his career he has many publications and book chapters. So with that as by way of introduction, I'll turn it over to Mark for today's presentation. Welcome, Mark.
Thank you, Jim. Good morning to the colleagues attending from across the ocean, and good afternoon to those attending in Europe. This webinar is about an investigation whether or not glyphosate should be classified as toxic after repeated exposure. We're going first to talk a little bit about the criteria for the selection of the studies, and then afterwards discussing the results in the rat, in the mouse, in the dog, and in the rabbit. Then afterwards we will formulate an overall conclusion on the repeated dose toxicity of glyphosate, and then investigate whether or not glyphosate should be classified as toxic to specific organs after repeated exposure. So, in this presentation, only consideration is given to the results of the most recent oral repeated dose toxicity studies that have been performed with technical glyphosate, and that is glyphosate acid. With most recent, I want to say these are studies that have been conducted during the last 25 years. Results of oral repeated dose toxicity studies of 90 days and longer are considered that are in compliance with internationally agreed test guidelines, like OECD test guidelines 408, 409, 451, 452, and 453. And these were applicable then at the time of the conduct of the study, and that the studies have been performed in accordance with good laboratory practices. By way of exception, also embryo-fetal development toxicity studies in the rabbits, according to test guidelines 414, are considered for the evaluation of repeated dose toxicity. Some less compliant studies that are considered by the reporting member state as supplementary are also also used for the toxicological evaluation, but are given less weight in the weight of evidence analysis. Now, let's have a look at the rat data. So the rat chronic toxicity studies that have been selected for this evaluation are three 3-month studies, 1 12-month study, and 3 24-month studies in the rats. The rats used were very current, commonly used strains like Wistar or strain Dolly. You will see the dose ranges that have been employed. Now, the results are depicted here. These are the same studies, but with the no observed adverse effect levels, the lowest observed adverse effect levels, and the clinical and gross necropsy and other results observed at or reported at the lowest observed adverse effect level. So what can we conclude from these studies? In the first place, there are no observed adverse effect levels. And I said that can be reasonably derived from the rat studies. Reasonably derived wants to say the highest NOALs, but which are substantially still lower than the lowest low observed adverse effect levels. And on the basis of these criteria, the NOALs derived are for exposures during 3 months, 168 milligram per kilogram for males and 195 milligram per kilogram for females. For exposure time of 12 months, we have 141 milligram per kilogram for males and 167 milligram per kilogram for females. And for 24 months of exposure, which are the chronic/carcinogenicity studies, 104 milligram per kilogram for males and 115 milligram per kilogram for females. When we consider the lowest observed adverse effect levels, and these are actually the levels that should be taken for consideration for classification as toxic for specific organs after repeated exposure. For these rat studies, when exposed during 3 months, we have 569 milligram per kilogram for males and 637 milligram per kilogram for the females. For exposure during 12 months, we have 560 milligram per kilogram per day and 6 for the males and 671 milligram per kilogram for the females. When we prolong exposure up to 24 months, which is the maximum exposure time tested, we have 354 milligram per kilogram per day for males and 393 milligram per kilogram per day for females. So what can we conclude from all these studies? In the first place, no specific target organs could be identified in a consistent way. That means to say that we see specific effects showing up in every one of those studies. Some effects, such as papillary necrosis in the kidneys, or basophilia of the acinar cells in the salivary glands, hepatitis, and prostatitis, they were noted, but only in one single study and were not confirmed in the other studies. It can be considered as incidental findings. A decrease in body weight gain and a distension of the cecum were observed in several studies, in more than one study, and can be regarded as related to glyphosate exposure. The distension of the cecum is due to gas formation in the cecum, and that is a consequence of disturbances in the gastrointestinal tract. Let's have a look at the mouse data. So what kind of studies do we have? We selected 4 studies that are reliable studies for the analysis of possible classification. We have 1 study of 3 months exposure and 3 studies of 18 months of exposure. They've been carried out almost all in CD1 albino mice, Swiss mice, but there is 1 Swiss albino of a different strain, and that was the study carried out in India by Kumar in 2001. You see here the results of these studies with the NOAL and the LOAL. A couple of remarks that have to be made is that for the Kumar study, the NOAL and LOAL that you see have been derived on the basis of the incidence of malignant lymphoma. After thorough reanalysis of the statistical significance of malignant lymphoma in several organ systems, it has been concluded that the malignant lymphoma seen in that assay is not related to glyphosate treatment. So in a certain way, these NOALs are based on actually have not been used if they have to be based on non-neoplastic lesions. And then if you look at most of the effects, they are relatively aspecific, and they only have been observed for extremely high chronic doses, like up to 6,295 milligrams per kilogram, which is quite unusual for chronic toxicology studies. So the NOALs that can be reasonably derived from the mouse studies using the same type of criteria as I explained with the rat. We have for studies during 3 months 1,221 milligram per kilogram for males and 1,486 milligram per kilogram for females. For the 18-month studies, which is the longest time normally for exposure, chronic exposure for aggregate chemicals, we have 838 milligram per kilogram for males and 153 milligram per kilogram for females. Now let's have a look at the lowest observed adverse effect levels. There we have for non-neoplastic pathology 6,295 milligram per kilogram per day for males and 7,435 milligram per kilogram for females for an exposure time of 3 months. If you look at the results of exposure times for 18 months, we see that we got more than 838 milligram per kilogram in males and 787 milligram per kilogram for females. Now, if you look at all the data we have in the mouse, including the LOALs and NOALs, we see that there is no specific target organ that could be identified in a consistent way throughout the study. Some effects, such as cystitis or the urinary bladder and distension of the cecum, were reported in one single study but was not confirmed in the other studies, so it could be regarded as an incidental finding. The decrease in food consumption and body weight gain were reported in only one study. So that means that glyphosate has got an extremely low toxicity after repeated dosing in the mouse. Analysis of the dog data. And the dog is actually the most representative species for if it comes to risk assessment in man. Well, there we selected 4 3-month studies and 12 chronic studies for the dog, 12 months. All the studies have been carried out on beagle dogs. And what needs to be said that normally chemicals are administered to dogs via capsules, but here in this set, some studies use actually administration through the diet. In the Hodge study, carried out in 1996, there the test material given was of an unusually high purity, 99.1%. The purity normally used of glyphosate acid used for chronic toxicity testing ranges from 95% to 97%. For the Nakashima study, we have a problem because there is a lot of uncertainty about those levels actually tested, which makes this study a little bit less reliable for risk assessment. These are the results that we obtained in the dog, the NOAL, LOALs, and the effects observed for the LOAL. Now let's discuss that in the next slide. So for the NOALs that can be reasonably derived from the dog studies, these are for exposure during 3 months, 323 milligrams per kilogram in males and 334 milligrams per kilogram in females. For an exposure during 12 months. These are 440 milligram per kilogram in males and 448 milligram per kilogram in females. Very interestingly, the NOALs after 12 months are higher than the NOALs after 3 months. For the lowest observed adverse effect levels, there we see 1,000 milligram per kilogram in males and females for an exposure time during 3 months. For an exposure during 12 months, we have 907 milligram per kilogram in the males and 926 milligram per kilogram in females. These are very high doses for dog studies. Normally, dog studies show chronic toxicity at much lower dose levels. Now, what can we conclude of all the dog studies? That there is no specific target organs that could be identified in a consistent way. That needs to be present in every one of all these dog studies. In one dog study, a decrease in red blood cell parameters was observed in one dog study. But these changes have not been confirmed in the other studies and might be considered as an incidental finding. The poor clinical condition and a decrease in body weight gain were reported in several studies. So when glyphosate is dosed at sufficiently high concentration, then eventually the dogs get into a very poor clinical condition and then show all kinds of effects like lethargy and vomiting, etc. Analysis of the rabbit data. Now, the rabbit data, actually as an exception, have also been considered by regulatory authorities as a possible basis for classification of glyphosate as toxic after repeated dosing. The problem with rabbit data in this case is that the rabbit data are based on embryo-fetal toxicity studies, which actually have a very incomplete observational database. So the rabbit studies that have been selected are these studies. There are 7 of those studies, of which one study was not considered in this evaluation, and that is the study of Biden Patil, because there were serious reporting deficiencies in that study, like, for example, no individual data, no statistical analysis, no uterine weights, and no maternal necropsy, whereby it became impossible to track down the possible causes of maternal toxicity in this case. These strains of rabbits used, or most of them, are New Zealand white. There are a couple of exceptions, like in the Hoyo study. The Japanese white rabbit studies rabbits were used, and in the Toxicology study, the Dutch belted rabbits were used. The Tasker study, which was the early Monsanto study, was conducted before the application of good laboratory practice and before, the application of the OECD test guidelines. That was conducted according to good scientific practice. Nevertheless, this study has got much less value because there was too high mortality at a high dose, and only 6 liters could be analyzed in a high dose, which makes actually for embryo-fetal development analysis this study rather, invalid. And now we're going to have a more in-depth discussion of the observations in this study, because to the contrary of the results that we saw in the rats, the mouse, the mice, and the dogs, we do have toxicity effects in this case. Now, when we plot the results and then expressed in preterm maternal mortality of all the studies against all the dose levels that were used in all those studies in combination, we see within the circles increased rates of mortality. What do we understand by mortality? This mortality that I put in the table is a combination of spontaneous deaths and also of rabbits that needed to be killed because they were in a moribund condition or they aborted. The results, I indicated the zone that should be considered for classification in the case of rabbit studies in gray, and there you see that you have an increased mortality at 100 milligrams per kilogram, 175 milligrams per kilogram, and 300 milligrams per kilogram. So it's worthwhile to analyze very thoroughly the causal effect relationship between that mortality and exposure to glyphosate. And that's what we're going to do in the following slides. Now let's analyze one by one the studies in which mortality has been found and what the possible causes are for that mortality. In the Coles and Dolman study, we have one mortality in the control group. That was a rabbit found dead, and one mortality at 200 milligrams per kilogram, both below the dose of 300 milligrams per kilogram. So for the one in the control group, we found 2 minutes after dosing, blood in the thorax, inflated appearance of the lungs, large area of congestion of the right caudal lobe of the lung. And these are indications for malgavage. And it's very easy to malgavage rabbits. It asks for quite a lot of experience by the biotechnicians, but here actually the rabbit died of malgavage because of fluid in the lungs. For the 200 milligram per kilogram rabbit, we see exactly the same thing. Red lungs, fluid-filled thorax, test material in thoracic cavity, which also is indicative of malgavage. What can we conclude from this? So, from all the rabbit studies considered, this study, the Coles and Dolman study, can be dismissed because the two animals found dead, one at 0 and one at 200 milligrams per kilogram, had lung lesions, like blood in thorax, inflated lungs, red lungs, fluid-filled thorax. And these are indicative of malgavage. At the high dose level, that's beyond the range up to 300, one female was found dead and one female was killed for humane reasons. The clinical observations of these animals were hunched posture, lethargy, ptosis, hypothermia, and blood on the litter tray. At the high dose level, and that's very important to detail, 10 out of the 16 animals suffered from diarrhea and 2 out of 16 from reduced fecal output, which is indicative of very serious gastrointestinal disturbance. Let's have a look at the next study, the Martens study, which is far out the best study in the whole data set. And there we don't see, in terms of mortality, any dose-effect relationship. We have, at every dose level, investigated, 2 rabbits that needed to be killed. And for the 100 milligram per kilogram, the 2 rabbits were killed because there was abortion. One at the gestation day 19 and one at the gestation day 25. And this is because of loss of body weight, decrease in food consumption, few faces, and diarrhea. At the 175 milligrams per kilogram, one rabbit had to be killed for humane reasons because of its moribund state. Again, also for loss of body weight, decrease in food consumption, thin and subdued, few feces, no feces, and diarrhea. The other rabbit aborted, also because of the same reasons. At 300 milligrams per kilogram, also 2 rabbits needed to be killed because of abortions, and again, because of the same type of clinical symptoms that you see. So what can we conclude from the Martens study? This study is by far the best reported study, allowing the tracing down of the cause of death of all animals that died during the study before end of term. This study did not indicate any dose-effect relationship in the rabbits that needed to be killed either for humane reasons or for abortion. Only in the control group there was only 1 rabbit that needed to be sacrificed. All rabbits in this study had to be killed, mostly for abortion, and they suffered from loss of body weight, decrease in food consumption, diarrhea, few or no fecal pellets, brown to green to red, black watery content in the cecum, and gas formation in the cecum. Also, accumulation of hair-like substance, like hair balls, have been observed in the stomach, and this is indicative of gastrointestinal stasis. Now, the Hoyo study. At the Hoyo study, we have mortality for 3 rabbits. One rabbit was found dead, and the 2 others needed to be killed. So the one that was found dead, no cause of death was known, and the rabbits that needed to be killed was actually for abortion or premature delivery. So what can we say about the Hoyo study? So at 300 milligram per kilogram, 1 rabbit died, and the cause of death was not reported, and 2 had to be killed because of abortion. Both rabbits that needed to be killed for abortion had a hair bolus in the stomach and watery content in the large intestine and the cecum. So they were suffering from gastrointestinal disturbances. The hair bolus in the stomach is indicative of the slowing down or arrest of gastric emptying into the small intestine, which means that during chronic exposure, chronic gavage, the material that is not absorbed from the gastrointestinal tract is accumulating and causing an arrest of gastrointestinal motility. The rabbits aborted because of the deficiency of the gastrointestinal system to maintain the cyclic day and night cycle physiology necessary to maintain the nutritional status of the dam and therefore also the uterine contents. Gastrointestinal disturbance causes also stress to the dams, which can be contributory to abortion. And this is a well-known phenomenon in rabbit embryo-fetal development toxicity studies. The next study, the STOT-RE study. Important to note that this study has been considered supplementary by the reporting member state because of the low pregnancy rate at all dose levels and extremely high mortality at 100 and 500 milligrams per kilogram per day, which actually makes this study invalid in terms of embryo-fetal analysis. In that study, we had 2 rabbits found dead in the control and 4 at 100 milligrams per kilogram. 4 rabbits of the 2 rabbits that were found dead in the controls, we have one with the aspiration of gavage fluid as a question mark, which can be, as a consequence of regurgitation, or we have here the esophageal injury, which is indicative of malgavage. When we look at the rabbits at the mid-dose, 100 milligrams per kilogram, 1 rabbit died because of lung and trachea congestion and froth in the trachea, and there is 1 for which we found soft stools and diarrhea and cecum enteritis. Cecum enteritis can be deadly to rabbits when there is an accumulation of too much pathogenic bacteria in the cecum. There is no really reporting of necropsy of the 2 other rabbits, but the study also has been declared supplementary because of very bad reporting. So it was very difficult to derive from this study a possible cause for the rabbit mortality. So, in summary, 2 deaths were detected in the control group, 1 death in the mid-dose group, and 5 out of the 8 deaths were reported in the high dose, and they showed clinical signs and/or esophageal, tracheal, and/or pulmonary injuries like rales, trachea congestion, lung congestion, lung emphysema, and collapsed lungs. And these all can be attributed to malgavage practices. So there has been malgavage, a lot of malgavage issues throughout this study. And this may actually indicate less experienced biotechnicians gavaging the animals. So bad gavage practices combined with the poor reporting of the results put the reliability of the study in question. So we should not put too much weight on this study for the weight of evidence analysis. STOT-RE study, so the early Monsanto study, which has been conducted before the application of the OECD test guidelines. There we found in the controls 2 rabbits that needed to be killed because they aborted. At 75 milligrams per kilogram, 1 rabbit was found dead, but necropsy indicated pneumonia, which may indicate also malgavage or regurgitation, but combined with soft stools and diarrhea, indicating gastrointestinal disturbance. At 175, we have 1 rabbit that needed to be killed because it aborted, and it also suffered from soft stools and diarrhea, and 2 rabbits were found dead. And both of those rabbits suffered from soft stools, diarrhea, and gastroenteritis. For the 1 rabbit, and soft stools and diarrhea for the other rabbits. This study, as I already mentioned before, has been considered as supplementary because of too high mortality at the high dose level of 350 milligrams per kilogram per day, which made it completely impossible for a good analysis of embryo-fetal effects. So let's discuss the TASC-RE study. This study can be dismissed because the animals from all groups, and that includes also the control group, suffered from soft stools and diarrhea, indicating that there must have been a problem with the rabbit feed. Too low fiber content is a possibility, and that causes the gastrointestinal disturbance in those rabbits. Now, of course, if then glyphosate is administered on top of a low fiber diet, then you will have problems. The increased incidence in preterm mortality, 69% at a high dose of 350 milligrams per kilogram per day, can be attributed to the effect of glyphosate acid on the functioning of the gastrointestinal tract of the rabbits. Okay, so we saw all the studies and we discussed the mortalities of every mortality in all of the rabbit studies. Now let's more or less summarize the effects of glyphosate on the functioning of the gastrointestinal tract in the rabbit. Gastrointestinal stasis, which is the hair accumulation in the stomach. You know that rabbits regularly groom, and the hairs they swallow normally should transit regularly throughout the gastrointestinal system. But when there is a stasis, that means actually an arrest of the motility of the gastrointestinal tract, and in that case the hairs accumulate in the stomach and then more or less cluster together to form hair balls. What we also have is water retention in the cecum and gas formation in the cecum and rectum. And these are indicative of a complete abolishment of the unique and very sensitive gastrointestinal physiology of the rabbit, which is typical a day and night type cycle. The watery contents of the cecum suggest a decrease of water reabsorption from the colon, combined with the extraction of water from the circulatory system into the gastrointestinal tract through osmosis, which is caused by the presence of large amounts of unabsorbed glyphosate. This condition can lead to hemoconcentrations, hypovolemia, and shock. Diarrhea and loose stools prevent the rabbit from eating the nutritional soft fecal pellets at night, which with a loss of weight, starvation, and abortion as a consequence. So what can we conclude for the rabbits? The investigation of the cause of death in the embryo-fetal development toxicity studies in the rabbit has indicated that the mortalities that we saw are due either to malgavage, with spilling of glyphosate acid in the respiratory tract, causing aspiration, pneumonia, and irritation. Entry of glyphosate in the respiratory tract through regurgitation of gastric contents, causing irritation due to the acidity of the gastric contents. You know that we've seen the accumulation of hair balls. Accumulation of hair balls means there is a complete stasis. There is not anymore a gastrointestinal transit, which means that a lot of material is building up into the stomach, and when new material is gavaged, there is a risk of overflow of that material into the trachea with a pneumonia as a result. Let's not forget that the gastric content of acid is the most acid of all animal mammalian species, so it's around 1 to 2 pH, and if still more glyphosate acid is added, the pH is still lower than this. So it's a very acid material that gets into the lungs and causes irritation. We have the abolishment of the gastrointestinal physiological cycle by glyphosate because of irritation of the mucous membranes of the gastrointestinal tract, osmosis, so extraction of water from the circulatory system, large amounts of unabsorbed material with diarrhea, and on preventing rabbits from eating the soft fecal pellets, leading to malnutrition, loss of body weight, and abortion. All these effects are related to local activity of glyphosate acid in the gastrointestinal tract of the rabbit, which is unique and of no relevance to humans. When rabbits are exposed to glyphosate for 21 or 28 days via the dermal route, no systemic toxicity or mortality is observed up to dose levels of 5,000 milligrams per kilogram per day. The dermal dose of 5,000 milligrams per kilogram per day corresponds with an oral dose of 665 milligrams per kilogram per day, when a dermal absorption rate of 2.66% and an oral bioavailability of 20% is taken into consideration. In conclusion, glyphosate does not produce specific target organ toxicity in rabbits after repeated exposure, apart from the local disturbance of the functioning of the gastrointestinal tract, which is of no relevance to human health. So what does that mean for the classification according to the global harmonized system? First, let's remind ourselves of the different categories for classification. We have category 1, substances that have produced significant toxicity in humans, or that on the basis of evidence from studies in experimental animals can be presumed to have the potential to produce significant toxicity in humans following repeated exposure. Substances are classified in category 1 for target organ toxicity on the basis of reliable and good quality evidence from human cases or epidemiological studies, or observations from appropriate studies in experimental animals in which significant and or severe toxic effects of relevance to human health, important of relevance to human health, were produced at generally low exposure concentrations. Guidance in those concentration values are to be used as a part of the weight of evidence evaluation. We have category 2. These are substances that, on the basis of evidence from studies in experimental animals, can be presumed to have the potential to be harmful to human health following repeated exposure. Substances are classified in category 2 for target organ toxicity after repeated exposure on the basis of observations from appropriate studies in experimental animals in which significant toxic effects of relevance to human health, important to underline this, were produced at generally moderate exposure concentrations. In exceptional cases, human evidence can also be used to place a substance in this category. So the difference between category 1 and 2 is made by on the basis of a potency consideration, and the standard test to do this is the 90-day subchronic toxicity test. Thereby, we have a classification in category 1 when the LOEL is lower than 10 milligrams per kilogram, or we get a classification in category 2 when the LOEL is lower or equal to 100 milligrams per kilogram. So the guidance values refer to effects seen in the standard 90-day toxicity study conducted in rats. They can be used as a basis to extrapolate equivalent guidance values for toxicity studies or greater or lesser duration using dose or exposure time extrapolation similar to Haber's rule for inhalation, which states essentially that the effective dose is directly proportional to the exposure concentration and the duration of exposure. The assessment shall be done on a case-by-case basis. For the 28-day study, the guidance values are increased by a factor of 3. In the case of the embryo-fetal toxicity studies in the rabbits, of which the rabbits only have been exposed to a duration of about 2 weeks, also, the rules of the 28-day study can be employed. So, how does that apply to the glyphosate situation? First, the LOEL values of glyphosate in the rat, the mouse, and the dog treated orally for 90 days and longer, up to chronic, are all greater than the category 2 guidance value for 90-day studies, and that is 100 milligrams per kilogram per day. Mortality occurs in the rabbits, treated orally for about 2 weeks, at dose levels lower than a category 2 guidance value for 28-day studies, which is 300 milligrams per kilogram per day. But the cause of death was attributed either to malgavage and intolerance of the gastrointestinal system of the rabbit for glyphosate acid. The cyclic physiology of the gastrointestinal system of the rabbit is very sensitive and unique and not relevant to man. So if we quote a sentence from the guidance, substance-induced species-specific mechanism of toxicity, or it is more precisely demonstrated with reasonable certainty to be not relevant for human health, shall not justify classification. So the rabbit should not be used as a basis for STOT-RE classification as a consequence. Therefore, glyphosate should not be classified for specific organ toxicity. Thank you very much. I've got still more backup slides if you would like to have them discussed. I'm available to you. Any questions?
Thank you, Mark. This is Jim Buss, the moderator. Again, thank you, Mark, for an excellent and very clear presentation. One question that I would have you perhaps expand on a little more is relevant to your last discussion, and that is, what is the current status of the STOT-RE review within the EU for glyphosate?
The current status is there are proposals for the classification of glyphosate in category 2 STOT-RE, so toxic for organ specific toxicity, and this on the basis of the rabbit results. And after the analysis I just explained to you, and since the gastrointestinal system is unique to the rabbits, and that the rabbit specifically shows intolerance for glyphosate acid, the rabbit should not be used as a species for the classification of glyphosate as toxic after repeat dose.
Thank you, Mark. That's exactly the information I think that's very useful for those listening in on the webinar today. I'm looking at my message board. I don't see any other questions coming in. I think that tells me, Mark, that you did a very clear and concise presentation, very effective in describing what was the range of toxicities seen across the different animals that were tested. Of course, the key to the STOT classification, the identification of the appropriate NOELs and LOEL values, all of which suggest that classification is not necessary. So, Mark, I want to thank you again.
Yeah, Jim. Jim, yes, I would like to add something to my presentation. An extensive screening of all substances having received a STOT-RE 2 classification from the CLP inventory and selection of all those being tested in embryo-fetal development toxicity studies in rabbits from REACH dossiers, CLH reports, and RAC opinions, and classified with no specific target organs, revealed that until now, not one single substance has been classified solely on the basis of rabbit development toxicity data, with the total absence of such effects in other animal species. And is therefore also that this would be the very first time that the substance would be classified based on this.
Thank you, Mark. That's a very useful clarification. In fact, that very point was one that was just coming to my mind as you interjected yourself on it. So thank you for that series of observation. I think that's very important to consider the context of this particular chemical, glyphosate, relative to all the other decisions that have been made with respect to STOT classification. So I think that perspective is very useful. Well, seeing that there's no other questions on the board, again, I think it's attributable to the fact of the excellence of your presentation, Mark. So again, I thank you for that. I want to remind all of the attendees that should you have a question after the close of today's webinar, please submit it to the website, which is www.glyphosate.eu, and we will have the presenters, Dr. Martens in the case of this webinar, or if you have questions on the previous webinars, we can contact the speakers for those webinars, and they can provide the answers for whatever questions you might have. I thank you all again for participating today. I hope you'll find that not only this webinar, but the previous three, if you are looking for an overview of the human health and animal toxicity effects of glyphosate, I believe this webinar series represents an excellent reference place to gain perspective in terms of the overall toxicity and potential health effects of glyphosate. So again, I thank you all for participating in today's webinar, and with that, I will close it again, and thank you again, Dr. Martens, for an excellent presentation.
Yeah, thank you, Jim.